You know, it takes a lot of work to get to the big leagues. There's a whole bunch of time spent in the gym and at practice, and then countless number of games. You know, more little leaguers are playing more baseball now than ever to try to improve their chances of being big leaguers. But that year-round schedule could be doing more harm than good.
Figgy. There's a line drive right field. Cody Ross, good throw. Ackley is in there. Mariners win it.
A perfect night at Safeco Field adds to the allure of being a major league player. Little leaguers everywhere dream of stepping between the lines, facing baseball's best, and coming out on top.
A big win for Felix Hernandez.
But many of them are sabotaging their chances of ever making it to the big leagues.
The problem that I see, and a lot of us who treat athletes see, is an alarming increase in baseball-related throwing injuries. What we see is that youth in the age of 9 to 14 have an alarming increase of elbow and shoulder injuries.
Dr. Edy Kelvin is an orthopedic surgeon who's worked with the Mariners since 2006. He works with many professional athletes in the region, and he's trying to become a bellwether for future major leaguers and warn them of the dangers of playing and, in particular, pitching too much.
What we're seeing is that the more kids play, they play year-round, they play in showcases, they don't take a break. They're the kids that are more likely to get injured, more likely to have surgery, and more likely not to go on to play at a higher level in high school or college or in pro sports.
Current Mariners are shocked to learn that little leaguers as young as 9 or 10 are experiencing significant arm injuries. They're even more stunned to learn that some parents assume surgery is the best route.
It's not fun, and there's no guarantee. That's the thing, is a lot of people, you hear comments, I've heard comments from people about, oh, I'm going to get my son the surgery right away and get it over with, and they'll be stronger. And they don't realize, A, just because you have the surgery doesn't mean you won't ever hurt it again. I'm proof of that.
You don't even want to go down that road to begin with. I mean, I just remember when I woke up from surgery the first time, I never thought I'd throw a ball again.
Both Charlie Furbush and Sean Kelly have undergone Tommy John surgeries. Kelly also had a partial Tommy John procedure done in 2010. The surgery has become commonplace in baseball, so much so that it can be easy to overlook the severity of it. The surgery involves taking a ligament out of the elbow and replacing it with a tendon from elsewhere in the body. According to Dr. Khalfayan, the success rate in adults is about 85%, but it's less effective when performed on high school kids, and there are no guarantees.
I think that's a common misperception, and actually there are some parents who will come in with their baseball player and they've kind of got the idea that having Tommy John surgery is going to increase their son's velocity, and that's just not true.
You come back stronger because of the year of work that you put in and knowing how to take care of your arm better the next time. You know, until you do it, you tend to just go out there and just wing it and throw, and then all of a sudden you have surgery. Now you have an exercise program, now you stretch properly because you don't want to go through that pain and agony of 12-month recovery, and that's where you get the strength from. There's no miracle surgery, and if you ask any doctor, they'll tell you that.
Everyone thinks you're going to come back better and stronger just because you get surgery, but it's what you do if you have to get surgery, what you do to get back.
The easiest prescription for avoiding surgeries, elbow and shoulder injuries, is rest.
If a player's having a fatigue, if their arm feels dead, if they're tired, or if they're having pain, they need to stop throwing. Studies have shown that if a player continues to throw when they're fatigued, they have a 37-fold increase in the risk of having an elbow or shoulder injury that may require surgery. That's an astronomical amount of increased risk.
When you're young, you're resilient, but at the same time, I think there's just such a push to for a lot of kids that they want to be the best. Their parents want them to be the best, so it's like lessons, it's year-round baseball, and you know, I went through some surgeries later, but when I was younger, I mean, I played different sports, so I took breaks. And, you know, you have to rest your arm. I think you can overdo it.
Some try to emulate their favorite pitcher, like Felix Hernandez. He routinely pitches deep into games and throws 100-plus pitches. But not even Felix pitched every day as a little leaguer. His routine? Pitch one game and play the next 2 at shortstop. Charlie Furbush once started both games of a doubleheader. Looking back, it was a crazy thing to attempt.
Better be safe than sorry when it comes down to it. I know I was the prime example, though, of a kid that was just throwing every day and not really even thinking about hurting myself playing baseball. You just think it's just an injury-free sport. You just play for fun.
Number one, adhere to pitch counts. Number two, don't play year-round. Take a break from baseball for 3 to 4 months. Let your arm recover from that amount of throwing. The other thing is that they should never continue to pitch when they have fatigue or pain.
It can be a tough decision to make in the moment, but it's one that can help avoid pain and surgery in the future. And in hindsight, it's one that Furbush himself would have made.
Yeah, I mean, if I could read the future, for sure, if I knew that was going to happen.